Hi there, everyone, and welcome to the Winning Conversations webinar tonight. Thank you so much for joining us. Our topic is going to be feedback and gaslighting in medical professional development. And we felt that, we've had some great discussions this year with the series of webinars we've done. And the goal here was consistent with, what our mission has kind of been is to bring these kind of esoteric topics to light so that we can all kind of have a better grasp of them and we can harness them for our overall professional development. All right, tonight I'm Karen Patel. I'll be your moderator. I'm also the president currently of the NANS WIN committee, and our panelists includes Dr. Ellen Eyre, Dr. Dalia Almafti, Dr. Samantha Arosa, Dr. Christy Hunt, and Dr. Soon Sheen. And also, as always, we wouldn't be able to do this without help from our NANS coordinators, Lily DeSchaff, Adriana Silbener, and also Chris Welber. So the format, this is going to be a 60-minute webinar. The viewers are going to be, you guys are going to be in listen only mode during the presentation, but please do type your questions in the chat box at any point during the presentation, because we do want to get to them. I'll be looking at them and making sure we pose them to all of the speakers. And also any of your own, whether it's a question, whether it's your own experience or any comments on anything that was said, please share your thoughts. We definitely want to enhance the experience by everyone's participation. This webinar will be recorded, so if you have friends who were not able to join us tonight, do tell them that they can access it on neuromodulation.org as well as the NANS YouTube channel. So in general, I think many of us go through our professional careers and we don't really understand the fact that there is a fine difference and a very distinct difference between giving feedback versus giving someone an evaluation. And hopefully our conversation tonight will really kind of highlight that and really give some shape to what that looks like in terms of giving feedback versus an evaluation. We're going to look at some specific relationships about a junior, giving feedback to a junior, giving feedback to a peer or colleague, and giving feedback to a supervisor, and a supervisor giving feedback to a junior. We're going to look at the various factors that really affect how people receive feedback in terms of the personality types of the person who is giving the feedback, as well as the personality type of the person who's receiving it. And then we want to highlight this issue of gaslighting. So gaslighting, the term, for those of you who aren't familiar with it, it actually dates back to a story about a woman whose husband, this is the story that I remember. The lights were dimmed slowly in this by her husband, and she was convinced that she was blind, and that the lights were subtly turned lower and lower and lower, and so she thought she was losing her vision. And it's a term that is affecting somebody's basically emotionally manipulating them so that they doubt their own perceptions of reality. And this can unfortunately sometimes happen in the course of medical training as well as medical practice. And so hopefully our conversations tonight will kind of touch on some of these things that some of you may relate to. So the first aspect of feedback is what we want to highlight is the idea of giving feedback to a direct report. And so for this section, we have Dr. Soon Sheen, and we have Dr. Dalia Almafti. And Dr. Almafti, I know you often have to give feedback to juniors that residents that you supervise. And I know, Dr. Sheen, you're a resident currently, is that correct?
Yes, yeah.
you've definitely, on the early side of your medical training on the receiving end of some of the feedback. And so, we really wanted to invite you both to share your experiences.
Sure, I can get started. So for me personally, I think I really started reflecting on the feedbacks I've gotten so far, like as I'm starting like my final year in residency. And our program is actually like pretty good at making sure that we feel like we've gotten adequate feedback throughout the rotation, whether it's directly from the attending or through program director. But like the more I've reflected on them, I feel like a lot of the sessions like end up being more like verbal evaluation sessions, like Dr. Patel kind of alluded to, rather than like a true feedback session. And like to be very fair, I don't think I really started like distinguishing feedback and evaluations until recently. I think I like read somewhere that like evaluations are like subjective judgment, where like feedback is like formative information that's like really meant for you to like improve regardless of like your performance level today. And I think that like really opened my eyes a little bit, because at least like from my experience so far, I think a lot of feedbacks have been like very like much more evaluations. And like throughout my training, I think the most challenging feedbacks I've gotten are like those like subjective evaluations without specific suggestions. So like for like an example, I think one of the attendings like just walked in one day and said, oh, you guys need to just step up, or you guys need to be more organized, without giving us that specific examples or suggestions. And like as a trainee, I personally struggle like extracting like learning points out of those subjective evaluations. And like I've learned to ask more for like specific feedbacks and asking for more specific ways. But I also feel that sometimes like it's not talked about enough. So like sometimes our attendings aren't necessarily ready to give that specific feedback. Um, yeah, and like I say this, and I think at the same time, especially as a trainee, it's so hard to like self-evaluate. So I definitely do value that evaluation, but like at the same time, as you had mentioned, Dr. Patel, I think there is definitely a need to distinguish evaluations from feedback, because especially like personally, like as a trainee and as kind of like a walking definition of like imposter syndrome, sometimes it's like definitely challenging to extract out that objective information. So like more neutral, like specific suggestions would be like helpful for me, so that I don't have to make like any assumptions when I process that information that I get from my attendings.
It sounds like you felt as if you had to fill in the gaps a lot, and you didn't feel like you were actually learning and evolving your skills.
Right. I think there was a lot of like assumptions that I had to make in terms of like how I need to improve with with kind of like the evaluations that I've got, rather than having like specific like references or suggestions that I could really focus on.
Yeah, I think that's really valuable to hear as somebody, who's a program director, even for me to hear that, definitely. That's really it's a really good reminder that, it's the prescriptive things that when you're in your training, there's so much coming at you, right? That the prescriptive information is really what allows you to kind of evolve. Dr. Al-Mafti, I know you supervise residents and are constantly giving feedback.
Yeah, so thank you for sharing that. Giving feedback, it is a skill set, and it's not something that everybody is trained on, but it is important for us to know, certain aspects of providing feedback. I think one of the most important things is, as you mentioned, to, provide specific information and provide an actionable plan. So I think by you bringing this up to your program director or your, if you have a class liaison, that is important. That way they can go back to the faculty also to reiterate and, teach, right? Giving feedback is a teachable event as well. So they can teach the faculty how to provide specific information and, as I mentioned, like actionable work where the resident can utilize to help improve their performance.
I think that both of you have really brought out some important points that really get to some core elements about excellent feedback. And Dr. Sheen, as you were talking about, you had to sort of infer what it was that was being told to you. I wonder how much of that is because there wasn't a specific conversation around specific things that were observed, right? Truly, feedback needs to be, or is best when it is related to the person giving the feedback should have observed what it was that happened. It should not be a hearsay. And that also helps us to get around this concern for gaslighting, is that we're actually able to reproduce facts. For me as a surgeon, I can watch and work with a resident in the operating room, and I can say, I would like to see you rotate your wrist differently, random example. And they may not understand, and I may say, well, when I saw you do this, this is what happened. So what if we tried this? And that then becomes linking it to a direct behavior and giving them something actionable. And it's also much more real to them, as this is a concrete thing. And I think the other part is that I want to just kind of early on say in this whole conversation, we are so often thinking of feedback as just the negative things. What is it that you need to do better? And there's so many parts of learning where you may naturally do something, or even sometimes accidentally do something in the course of caring for a patient that was really good, that we as your educators, mentors, want to see more of. And we don't do a great job of saying, that was good, keep that up, do it again. Because that is as much a part, needs to be as much a part of the feedback as the opportunities for improvement.
For those of you who do not know, Dr. Ellen Eyre is the Vice Chair and Residency Program Director of Neurosurgery at Henry Ford, and has actually developed a tool of how to give feedback in training dynamic. And so we're going to reference a lot of her work throughout this conversation. And so it's a real gift for us to have Dr. Eyre on the panel tonight to again give us her leadership in this area. So I think we're going to move to the next section. See here. So in this section, we're going to talk about how to really give feedback to a colleague, somebody who's considered a peer, because that can also be kind of a challenging situation, particularly, one that's encountered, when you're co-residents or you're co-fellows with someone, or when you're in practice with someone, whether it's academics or private practice. I think that can be particularly challenging. Dr. Hunt, maybe you can share some of your experiences with having or giving feedback to a colleague or peer.
Sure. So I would say that when it comes to giving feedback to anyone, but particularly to a colleague, it's so important that it comes from a place of authenticity, right? And that place really kind of comes from that shared relationship. So, when you know somebody well enough to give them feedback, we really want to think about what's the foundation that we're building on, right? Is it a foundation of trust, of mutual respect? If it's not really coming from that place, I think that it becomes really challenging for that feedback to be communicated and indeed received in a way that's meaningful and productive, right? So I would say that that's really important, like I said, probably with any feedback kind of encounter or communication encounter, but particularly with a colleague, because you really want to kind of come away from that with hopefully, relationship even more improved, right? Seeming more honest and open, but you certainly don't want that to erode your friendship in any way, or your relationship in any way, right? So some of the kind of comments that are sort of mentioned here, have you ever been in that situation where you've met somebody and you don't know their, and you were introduced to their name, but they didn't have the name badge. The name didn't really sink in, right? And you maybe see them again from time to time, and what's their name? It gets to the point that it's a little awkward, right? Like, man, I should have just said, what was your name again one more time before it got, maybe you're at a conference and you're milling around and you've talked with them 3 or 4 times and you're coming back. It's a lot like that with feedback, right? So if you wait too long to kind of give that feedback, good or bad, it can almost seem a little bit difficult to kind of try to walk it back and mention it again. Maybe you've seen the behavior happen or the activity happen 3 or 4 times, and probably best to just kind of mention things early. And it helps the feedback to come from that more kind of friendly, open place, kind of a warm place, and less so from a sense of, gosh, this person's been kind of judging me or watching me for some time. Why are they just now saying this? And that benefits your colleague to a greater degree, right? Again, whether this is positive feedback or negative feedback, knowing early and often, if what I'm doing is effective or working well or not, it's helpful for me to know, which is really good for that relationship. When I think of the times that I've given feedback and that I've received feedback, it's always been most effective when that's with somebody who I trust and who they trust me. And indeed, I will go to that person and ask for feedback, right? I remember one of the most challenging moments in my career was when I was transitioning from trainee to staff. And I was walking and talking with somebody who was about 10, 15 years my senior, but was now a colleague. And I said, gosh, Matt, how do I know if I'm doing okay, right? I go from these quarterly reviews and monthly reviews and evaluations to just nothing, right? How do I know if I'm doing well? And he looked at me and he said, you'll know. And he meant that in a kind way, but I remember thinking, I really need something more than that. So I've kind of taken upon myself sometimes to go to a colleague or a friend or somebody that I trust and say, hey, how do you think that went? Do you think that went well? And I think that it's within those contexts of me kind of proactively, sort of opening up that relationship and opening up that door, that it makes it even easier to give feedback in a way that's helpful, that's friendly, that if anything only helps strengthen that relationship, but then also helps the feedback be effective. So that might have been a little bit long-winded, but
no, not at all. That's a really interesting point. Dr. Ayer, what are your thoughts on that? So, you transition from a trainee, right, to practice, whether that's academics or private practice or somewhere in between, and you're looking for this prescriptive type of feedback. What is your general advice to both people giving and receiving feedback when you're colleagues?
I think what you brought up, Dr. Hearn, is just so critical, which is how do you, and the importance of fostering an environment of feedback, that is something that just happens. It's normal. It's part of the natural day-to-day give and take of our practices. And that when we open ourselves up to that environment, when we ask for feedback on ourselves, that makes others also more open to receiving that feedback themselves. And so that's you mentioned that I've been doing some of this work at Henry Ford, and part of that has come out of collaboration across our system, where that's exactly what our goal is to create this culture across the system where our faculty, our residents, and people across the spectrum feel empowered to be able to have that conversation. So the more you ask and the more you, as you mentioned, do it early, not catching them off guard, you're making it a conversation, you're relying on that relationship and recognizing that if you're giving feedback, it's because you care about that person. You want them to get better. It's way easier. If you don't care about that individual's development, it's way easier to walk away.
Dr. Al-Mufti, you're also in an environment like an academic environment. What is your experience with giving or receiving feedback to a colleague?
Yeah, so as Dr. Hunt mentioned, I think one of the most important thing is to have an established relationship with your colleague. It would be very awkward to provide feedback to a colleague that you barely know. And I think most of us in our work environment, in our work setting, our colleagues actually become part of our work family. So that's the base, I think, foundation before even considering giving feedback, is kind of determine the type of relationship you have with that individual to gear how that feedback is going to be delivered. I can go to one of my colleagues that I've worked with for 10 years and just tell them, hey, can you tell me what did I do wrong? And they're going to tell me directly in my face what I did wrong, versus me going to somebody that I only know maybe for the past few months, where I might want to give them feedback. And it's not walking on eggshells, but you are going to be a little more, I don't want to say cautious. You still want to give the feedback, but you want to provide it in a way where it's neutral and where that individual can perceive it as Dr. Ayer mentioned, something that's going to benefit you and improve you. So I think it all, again, kind of when it comes to colleagues, goes back to the relationship that you have with them and how you can approach them.
Dr. Ayer, what's your advice for somebody who might be listening to this webinar who, says, I feel like I don't really have that in relationship where I'm working right now. And I don't really feel like my work environment is one which fosters naturally giving feedback. And in fact, it might foster giving criticism or evaluation. What's your advice?
Yeah, and that certainly still happens. I think it depends a little bit on what your position is and how you start addressing that. So if you have individuals that you are supervising, starting by having those conversations with them and saying, I'm going to establish this. We're going to do a clinic, we're going to do a surgery, we're going to do a procedure, we're going to do whatever it is. And at the beginning, we're going to talk about what it is we're going to try and learn and accomplish from it. And at the end, we're going to talk about what we did learn and ways that we want to carry forward and things that we want to improve. And so you can start having that level of conversation and supporting that in one area. Asking others for feedback, I do think is important, but I think that asking a lot of questions about where people are coming from. If you feel like they are not, you're missing something in a conversation, something's not landing well, start asking more questions, because a lot of times that making assumptions is something we do more often than we would like to admit. I just heard a recent story of someone where the faculty wanted their educational person to talk to a resident because the resident had a terrible day in the OR, and the faculty's version was they need more confidence, they need to operate more. Well, when the faculty actually went and sat and talked to the resident, the reason that was such a bad day is because that resident had been up all night long when they should not have been. And so you start making these assumptions about what goes into an experience with somebody, you may completely miss the boat, and therefore that feedback, that input lands wrong and then carries forward into more miscommunication.
I think that's really an excellent point, because sometimes life becomes fight or flight, right? And sometimes when we think somebody's making an evaluative decision about us or judgment, we kind of shy away from it. But I kind of like that, and not to be ironic on a win webinar, but to say leaning into it and trying to get more information, like, well, why are you saying this? Where is that comment coming from? I think that's some excellent advice. So with that, we're going to move to our last section here.
I will just add, as you're making that transition, that it's not just where are you coming from, but asking that question in a way that is truly inquisitive rather than defensive. We all, want to go to our corners and put our dukes up and defend ourselves, and sometimes you just have to say, okay, wait a minute, I'm just missing something. Let me just take it from the perspective of I probably am not. We're not understanding each other.
Yeah. I think that's great advice. So our last section is about how to give feedback to a supervisor. And so Dr. Samarosa, we've had you on this panel here. We want to hear what your experience is with giving feedback to supervisors.
Definitely. I think this might be a good segue from what Dr. Ayer had just mentioned too, but I'll give an example from a bit earlier on this year, and I'm currently in fellowship. So I'd say probably about maybe the second quarter into fellowship, I was in clinic, running a clinic and seeing a new patient. And maybe about like 7 or 8 minutes into the visit, I heard a knock on the door, and my attending had come in and was kind of standing there and was like, continue with the visit. And so in my head, this hadn't happened before, where it was like an unplanned drop in where the attending was now joining. And so my mind is racing through a couple of things like, do they think I'm slow? Are they just trying to be more efficient here? But now I recognize that I'm distracted. The patient, who arguably is there to see that attending, is now excited because the person is there. And so the focus just shifts. And so I continue through that visit, probably overthinking about it. It happens again in the same clinic. And so now I'm like, I wonder, there's still patients that need to be seen if it's for efficiency. So now my brain's just spiraling. And I'm like, why is this happening? So we get through the clinic, and I tell myself, okay, should definitely talk to this attending about this, just to get more information about what is the intention here. As Dr. Ayer said, we tend to think the worst, or we start to overthink or kind of go in a direction that may not be the case. So I wanted to get, his feedback. And so at the end of the day, and I knew we didn't have time during, and it's not appropriate to do it in the middle of a clinic, but by the time we were winding down our notes, I asked, I was like, hey, Dr. So-and-so, I wanted to ask you, earlier you hopped into a couple of, our clinic visits in the middle of it. And I just wanted to get your perspective, why you might have done that. And one of the first things he said was, oh, Sam, it's not just you, like I do it with all the fellows. And so my initial impression of that was like, okay, well, that's cool to hear, but at the same time, like, but why, And so I shared from my perspective that when we are trying to build rapport with the patient and trying to build trust with the patient, it makes it difficult to then have that interruption, and the shift focuses to, the attending who's now standing in there. And so I kind of expressed that for me to grow my confidence and my competence, I just want to understand more. And he's like, oh, I just thought it'd be quicker if I jumped in the middle of it. And so I was like, okay. So I didn't argue about what would have been quicker to run, their clinic, which is not the point of it. But it was helpful for me to know, he doesn't think I'm incompetent. He doesn't think that I'm slow. It didn't have anything to do with any of those things. But I wouldn't have known that if I didn't have that conversation with him. And I think it's easier for me now as a senior trainee to have that conversation. And I'm not sure I would have had the confidence to have that same conversation as a PGY2 PGY3, for example. And so at the end of it, there really wasn't any solution or conclusion. It was like, oh, I just thought it'd be faster, and I kind of like let it be. But the interesting thing is that it never happened again after that. And so whether it was because we had the conversation or, it be a different clinic day, I think it was effective to have that feedback, understand his perspective, so I don't go down the rabbit hole. And then it turned out that clinics thereafter were fine. It ended up being okay, but it's not an easy conversation to have, but I do encourage having it in real time. Right after the clinic happened, I didn't wait 3 weeks to then bring it up. It was a real example that had just happened, and so it was a very easy conversation, but it can be hard to start them. I'll pause there.
So Dr. Ayer, I mean, you've been helpful through all of our scenarios tonight, but I think this is certainly something that, touches close to home for you. I mean, as your, program director for a residency for neurosurgeons, what's your experience with, receiving feedback from residents and, trainees?
I request it. I elicit it. It is now and it's not something that I've done my entirety as a program director. It's something I've come to more recently, but I think it's really important for me to put my money where my mouth is in terms of saying, this is the culture we're going to have, and you should expect this from us. We also expect it from you. And so I'm always asking along the way anyway, but I now have also made it part of my of formal 6-month evaluations is, okay, this is evaluation, this is summative, this is pulling together everything. But now I'm going to ask you specifically for things that I can do better, and how can I make your training better. So I think that, you know, the more you're open to it, but, you know, I still have to have these conversations with my supervisors. You know, I still have to go to them and say, you know, I'm concerned about how that just went. Can we talk about it? I really just want to emphasize what you said, Dr. Rosa, which is that questioning first, asking up front and saying, hey, like, what's going on? Or I was concerned about that. Is there, what's happening? It just opens the door. And I think for even when people are expecting feedback and you've gotten to that culture, starting any interaction, having that two-way conversation to level set is really important. So I see you've sort of flipped over to this sort of summary slide. So Dr. Patel had asked if I would give kind of a nutshell version of the principles that we have been teaching at our institution. And that two-way feedback, a two-way conversation, I should say, is core to it, because it opens up to, you know, get rid of any of those misconceptions. But let me give you an example. So we will, in neurosurgery, we obviously have a lot of times where we're doing feedback specifically related to a procedure, but it doesn't have to be that. It can be, you know, a clinic appointment. It can be watching them give bad news to a patient. You know, there's so many opportunities, watching them teach a younger learner, whatever it is. But if I'm, for instance, going into the OR, I can say, okay, so what are you looking to get out of this, and where are you in your comfort level and your skill in what we're about to do? You know, if I have an intern say, I'm going to do this neck surgery skin to skin, well, okay, now we need to put the big pause on, and that's okay, and we can have a clear conversation to say, okay, let's break it down a little bit more. Let's, you know, figure out what are the parts that we should emphasize in your learning and where you are right now. But I also, it keeps me from trying to reiterate things that they feel comfortable with, and it means that I can understand where their learning edge is, where it is you want to go. So you can do that, say, before a rotation. You can do that before a clinic. There's so many opportunities where you can say, for the next whatever situation, you know, where do we want to go and learn where the other person's at. As I mentioned before, really critical that you observe what's going on. You should not be giving information that was not observable. So if you, as a teacher, are learning or hear that there are issues that are going on, but you haven't been there to observe, then start putting yourself in that position. I mean, you're allowed to share that as an evaluation, but the alternative is, if there are other people who are noticing some of those actions, that those individuals need to step up and help with some of the some of the feedback. Once we've gone through whatever that encounter is, then I always start with asking the learner, what is their impression? What went well? They will always want to tell you what they thought they did wrong and what they think they should do better. But getting back to that core piece, that feedback is not only negative, it has to go both ways. You want them to re-imprint in their brain what went well, and gives you an opportunity to say, you know what, I also thought that went well, because I want you to do it. And it also just sets up a more positive for where you're going to take the conversation. And I don't mean this at all to say a feedback sandwich is a good idea. I think a feedback sandwich is actually terrible, because as I heard someone say, the problem with a feedback sandwich is too many carbs. Right? You end up listening to the goods on the front end and the back end, and completely everything in the middle just goes by, and you're not getting the point of where you can go forward in a better way. So you do want to have both the good and bad conversation, but the more it's driven by the person you're giving feedback to, where they can say, this is the problem that I had, this is what I thought I could have done better, the better you are able to hear where they are at and how you can make your comments sink in. And so that way you can then turn it around, and somebody might say, well, I thought I did this, and you looked at it and you said, actually, that's not the issue at all. I think if you had just done this instead, that would have been a huge improvement. Let's try that next time, right? So that's where you're able to take what they said. The more it's meeting where that person is, the more impactful it will be. And then close that loop, right? Have that conversation, figure out if there's something you want to try out next time, have a next learning experience, whatever that is. Talk about it. Say, what are we going to try for the next time? That's part of creating that environment. And even if you only are working with somebody for a day, it's not, it's a great idea to say, is there something, what is it that you're going to take away from today into your next rotation? So if you kind of try to, for me, we have a paradigm that we distribute across our system, but I think it's more about these core concepts of understanding, and then just kind of dipping into leaning on these when you need.
So I have two. We definitely want to answer any questions that you guys may have for the panelists. So please submit them to the chat. But Ellen, I have two kind of difficult questions for you. And one of them has to do with the concept of gaslighting, and what's your take on how that fits into, or how, unfortunately, it can, steer its not so pleasant head in the idea of giving feedback?
Yeah, so that is why the observing and action-based comments are so important and so critical, because you are open to, if you're the person giving the feedback, you're then open to, well, that's just their impression. They just don't like me. They're just saying that response. And that is a big barrier to receiving feedback, right? There are a variety of roadblocks. And as you mentioned before, sort of personality issues or just situational issues where, for instance, if you had a bad experience with somebody in the past, your likelihood to take positive conversation and feedback from that person in the future goes way down. So the more that you can be specific about objective things, the less that potential creeps in. And as somebody who is receiving it, if you feel like that is a potential, then you need to start asking for those specific pieces of information. As a residency director, and others here who are, in education recognize this, is that if you're doing evaluations, if you ever needed to make a decision based on those evaluations, you've got to have details that are written down. And that's a critical part. It also, the gaslighting issue is also around, or the risk there is when you're giving very obtuse things, general comments. You did well, or that really was terrible. We can't do that again. Well, can't do what? What is it? Was it a situation? Was it something personal? Was it an action? What was it? Because those kinds of generalized comments really can go in the wrong direction from my perspective.
We have a question here in the chat, which we kind of touched on, but the question is, what should a resident do if they feel they're getting poor evaluations, but when they ask for actionable feedback from their attendings, none is given? I personally feel that, I think you touched on this before, Ellen, that I think it's about having the environment so that if there are certain attendings whose personality maybe not to be able to, maybe they don't see the concept of feedback in the way that we do, right? And so maybe they don't understand that they need to give actionable items, right? But there are other attendings who probably can. And my advice to that particular resident would be to seek the support and feedback from other attendings within your training program. Dr. Al-Mafdi, Dr. Ayer, Dr. Rosa, Dr. Hunt, Dr. Sheen, whatever thoughts you have on that or experiences. If a resident isn't getting the actionable feedback from their attendings, that's just not being given, but they're being given poor evaluations on evaluation forms.
I think one of the things I've gotten better at, the more senior I've gotten in training, is to be a bit more forward with the feedback when you need it or when you want it. And I think a way to get ahead of that is a lot of the times the feedback we get is quarterly or it's through an evaluation. And for the most part, that's very retrospective, right? And so we hear it months later and you try to recall what exact moment, they may be describing. So what I do now, and it may be a little bit different from where you're at in residency, but in any encounter, whether it's a clinic encounter or in a procedure suite, after the encounter, I'll go up to my attending and say, hey, what could I have done better in that case? And being specific in saying, I know I can improve. I'm still in training. We can all improve. What did you see that I could have done better? And it kind of puts them on the spot a little bit. And the first 1 or 2 times maybe it'll be a little awkward because they weren't expecting you to say that. But if you become the resident that they know wants to hear the feedback, the next time you do something, they're going to be watching and they're going to be prepared. So when you say, hey, what could I have done better? They're going to say, oh, on that needle movement, I probably would have done it this way. And they'll be more specific. And then that way you can kind of get ahead. Odds are, if you start doing that, I imagine the negative feedback would probably become less and less because now you're being proactive with it. But curious to hear the other panelists' thoughts too.
I think that's great advice.
I completely. Oh, go ahead, Dr.
No, go ahead, Dr. Sheen.
I completely agree, especially coming from like that resident spot. I think it's definitely like what Dr. Rosa said. I think it's very important to ask for feedback. I think one thing that I've kind of worked throughout my training was kind of asking for specific feedback. If you get kind of general general feedback, non-specific feedback, it's really hard as a trainee to be like, hey, can you elaborate on that without kind of coming off as you're trying to question their feedback. So I think that's something that I try to work on, as asking kind of genuinely just for my improvement, hey, I'm having trouble with that specific feedback, can you give me a little bit more specific suggestions? And I feel like a lot of attendings were very open to it. And one of the attendings that I struggled the most in terms of feedback, actually, the more you do it, just like Dr. Rosa said, I think they get better at it too. They're learning how to give feedback too, as we're learning how to ask for that feedback. So I think kind of that repetitive, just asking at the moment is kind of the key piece.
I think that I would also try to understand what type, without knowing, it's a little hard to know without more details, but what type of negative feedback are you receiving? It's not actionable, but if it's, it's sort of is it sort of, focused on what you're doing in clinic, or is it somehow focused on sort of your behavior or demeanor? I feel like sometimes, without trying to make assumptions, sometimes I think female trainees, there's almost different standards or different expectations applied to them for that can seem like a different way that they sort of expect you to interact. And I think sometimes attendings aren't even aware of it. So I think that what would be really important is just to understand, is this just basic kind of clinical skills or procedural skills or that kind of thing. And making sure that it's kind of focused in the right area and an appropriate area, frankly. And I think if you have major concerns, it's totally fine to go to your program director and say, hey, I'm in this training program because I want to improve, I want to be better, I want to be excellent. And I really value feedback. It's very helpful for me, but I find it hard to really understand, what to do with this. You know, maybe, you know, you can say it maybe in a different way, you know, say, hey, I would love actionable feedback, right? Just like what you've asked for here. And it's really the program director's job to kind of help work within the department. And Dr. Patel can speak better about this than anybody, to sort of speak to her colleagues. I'm sure if a trainee approached her and said, hey, Dr. Patel, you know, I'm really looking to see how it can improve. And, you know, do you have recommendations or ideas of how I could get more actionable feedback? She could do a very good job of speaking to her colleagues about, hey, when you're doing these evaluations, these are great, be specific. So that could be a strategy you take too, is approach the program director.
Now, one of the things that sometimes I find helpful is to kind of use a consistent way of giving feedback. So, you know, I usually like to use that ask, tell, ask approach. And I use that consistently, whether it's procedural aspects or if, you know, a trainee is doing a history or physical exam. But it helps me, number one, understand what the trainee thinks they did or didn't do, right? So it's really important for me, as Dr. Ayer mentioned, is see what that trainee thought they did right, thought they did wrong, because in their mind, they might think that this was the right way. So that's the first approach that I take. And then after that, I tell them what my observation was. And then we discuss again. I ask them to like reiterate what my observation was about their performance, and then we come up with an action plan on how to improve things that might not have been done as well, and also kind of discuss about things that were done well and how to further progress.
I would say to your to that point about if you feel like you're in a position where you're not getting anywhere, I totally agree. You know, the whole goal of a program director is that somebody should be there to be your advocate. But if you are feeling like you're really struggling, or there's some areas, you said, Dr. Hunt, like what particular kind of area is it that you're having trouble with? If you can name, put to words what you think is happening, going on, saying, I'm struggling with X, can you help me? When you are providing that, you're opening that door and you're giving something very specific that you want somebody to comment on, it's so much easier. When I get a request for a letter of recommendation, I'm like, oh, I gotta like think about this whole big picture. If somebody comes to me and says, hey, Dr. Ayer, I just wrote this, can you review it and tell me, or you just watch me do X, you know, what can I do better? That's such an easier way for the person giving the feedback. You're just opening that door into a much more relaxed conversation, because they're not nervous and they're not as nervous about what they're going to try and come up with, say, because then they're like, oh, okay, I know what I need to focus on as I'm giving you feedback.
Awesome. I want to thank all of our panelists for joining us tonight. I think this was an awesome discussion, and I appreciate you all being so honest and, you know, sharing your experiences and perspectives. I'm gonna jump back here. So I encourage all of you who are tuned in, if you're not a member of, you know, NANS, certainly join. If you're not a WIN committee member, please join as well. We have so many ways in which we can get you involved, both with NANS and within the field, and provide mentorship. So please definitely get involved. So we have some upcoming webinars. We have the dorsal root ganglion stimulation webinar, something very important to me. The education committee webinar that's coming up, neuromodulation for cancer patients, as well as the financial wellness webinar. Diversity and Outreach Committee will be running that. And so this is all throughout the summer. I know we all have busy summers, but it's a great opportunity to, you know, kind of round yourself out on some very valuable topics. And of course, I want to remind you all to mark your calendars for the annual meeting. We are going back to Vegas, January 12th to the 15th. Very excited for this meeting. Innovative meeting program format. Very excited for all of us to get together again and to be back in Vegas. And I want to thank you for attending, and stay tuned for the next winning discussion webinar. It's going to be in September, and we're going to focus on making the most of your training experience for those of our fellows who are just starting. Wonderful. Have a good night. Thanks for joining us all.